Hi everyone, Dr. Timothy Gallagher.
And Dr. Michael Marciello.
And we're from Maragal Medical. Well folks, we've been talking to you about the 7-step plan of taking care of knee pain, shoulder pain, and hip pain. Well, today we're going to talk to you about what all of those 7 treatment options are here in our integrative medical clinic. There's going to be a lot of great information, so stay tuned. Okay, Dr. Mike, we've been talking to the group about all the different treatment options that we have available in our clinic, and sometimes it can be a little bit overwhelming for patients when they come back for the consultation with me after they have their exam with you or Molly, because as a integrated medical clinic where we've combined medical care, chiropractic treatment, and physical therapy all under one roof, there are a lot of different options. And we always stress to our patients, these are just options. We want to educate you about your condition and just make you aware of all the treatment options that you have in the clinic. So I figured this week we could kind of summarize all of the different treatment options that we have available through the clinic.
Absolutely, yeah, we think about it again, these 7 steps, but we're trying to think about all our patients in a similar way to make sure that they have all the options potentially to take care of their problems. Some people start one way, some people start the other way, but they have them all available to get, again, the best of their care.
Yeah, so first, number 1 is chiropractic treatment. So chiropractic treatment is the foundation of the clinic here. I started this practice 26 years ago. My background is in chiropractic, and I have 2 amazing associates, Dr. Dave Sherman and Dr. Rebecca Brooks. And we practice traditional chiropractic treatment as well as a specialized technique called decompression therapy. So there are some patients that come to the office where a traditional chiropractic adjustment just may not be indicated. Maybe they have a disc injury, maybe neurologically there are some signs, or maybe they're just a little bit nervous about having a regular adjustment. So the decompression table works really well where it provides gentle stretch or traction in the cervical spine and the lower back, all under the doctor's control itself. And I always tell patients too, simply put, the chiropractor's role is to get those joints in your body moving.
Absolutely, we want to make sure that the body is actually capable of doing all the things that we're suggesting, and movement is the key.
Yeah. Number 2, physical therapy. So that's my wife, Colleen Gallagher's area expertise. And Dr. Mike, we invested in this great robotics technology called Hanova, and that's really what distinguishes our practice on the physical therapy side because of this great technology.
Well, again, we're thinking about, standard of care. So the standard is physical therapy, and everyone kind of thinks about what that means, but we always like to add our little different twist. And that different twist is adding additional services to the PT's tools. And Hanova is one device that we use that for. So we have the ability to use balance, the postural aspects of our using the balance machine and the weight components, using a chair component. Yeah. All these techniques are additional tools for physical therapists to not only get standard physical therapy management, but also to add additional techniques that would enhance the person's ability to improve.
Yeah. We also have the ability, because we are a medical practice, to prescribe some supportive bracing, and we shorten that as it's called DME, or durable medical equipment. So simply put, like a knee brace or a back support or even a cervical traction unit can be very helpful in between treatments to help stabilize the patient while we get things stabilized, whether it's chiropractic or physical therapy, and also provides patients good support after if they do their regenerative medicine injections.
Yeah, we'd like to break down the myths. So many doctors will tell you that you shouldn't be wearing braces.
Right.
Those are bad for you, your body gets weaker. No, but we utilize things for support. You break an arm, you need a cast, you need to get a support, but it's not to the degree of immobilization. These braces are functional braces. We're asking the patients to utilize them at certain times to give their body breaks, to give the body a little bit of rest, and then we utilize that to say, okay, now we'll help you with the movement. As you progress through the program, then you wean away from the brace, but you have that available to kind of help out and enhance the treatment plan. So bracing is not a bad thing at all.
Yeah, that's great. And right along those lines, orthotics. So we have the ability to prescribe orthotics. We've been using Foot Leveler's laboratory down in Virginia, for the last 26 years. They've been making custom orthotics for patients over the last 70 plus years too. And what's amazing is there are so many different orthotic options. There's about 80 different types for a variety of different shoes. But most importantly, I think most patients have problems with orthotics because number one, they don't fit correctly. So we utilize this laser scanner to get a very accurate measurement of the foot itself. And then depending on whether or not the patient is wearing different types of shoes, or now they just released a group of orthotics for sport-specific shoes, we're able to make those recommendations for patients. And that helps overall mechanics, whether it's movement patterns, your balance, certainly affects posture, and that's a great addition to really emphasize getting to the root cause of the patient's problem.
Yeah, I usually say to my patients, this is not an arch support. I mean, you can get an arch support, maybe enhance your ability to, lift the inner part of the arch. We're really trying to think about custom position, so to help out those movements, because we don't think of a person just correcting a foot issue with an orthotic. It really is the mechanics of how a person stands, how a person moves, trying to prevent the chronic nature of getting out of position, getting other areas of musculoskeletal breakdown because you happen to be walking differently, standing differently. So the orthotic helps protect those, again, long-term issues, as well as directly addressing your feet.
Right. Class 4 laser is a great modality that we offer in our practice. We're one of the few clinics in the region that offers Class 4 laser. I've been using this and my chiropractors have been using this for the last, 8.5 years or so. This is a great modality that helps to decrease pain and inflammation as well as accelerate healing. And we're a medical clinic, so a lot of patients come in, they're in acute pain or distress. So we have the ability to write a prescription medication for pain control or as an anti-inflammatory. We tend to think very holistically, so we like to offer those patients other options. And Class 4 laser is a great option if the patient's not interested in using a prescription medication or even an over-the-counter medication, as well as a great substitute if they're considering a cortisone injection.
Well, that's the key. We are looking for a reduction of inflammation and irritation. So heat, ice, is kind of a classic, throw some ice on it. Well, this is another way to actually get in there and remove some inflammation without, like you say, not using an anti-inflammatory medicine. We can still prescribe that, but we reduce the amount. So maybe I'll give it for 3 or 5 days only, convert to laser, and then to get the movement so we can actually naturally reduce the inflammatory process instead of thinking, oh, I gotta stay on this pill for a long time or start getting the cortisone consistent. We try to avoid that, and laser is one way that we can help improve that inflammatory process.
Yeah, and finally, number 6 and 7, these are our injection options that we have in our clinic, and we have some incredible, cutting edge injection treatment options. So we kind of group them as number 6 and 7, but number 6 would be our regenerative injection. So when we talk about our regenerative injections, we're talking about human cellular tissue products or donor tissue injections, the wart and jelly allograft, and the PRP injection, which helps to repair and helps your body to help repair damage to the tissue, whether it's a knee or shoulder, a hip or spine injury. This is a great alternative to help just get to the root cause of the problem and repair that damaged tissue.
And I think that's the key. We are looking again beyond the immediate aspects of recovery or say, this is a short-term issue. We want the long-term recovery. We want to look at kind of getting a tissue injection. So we call them allografts because we're transplanting, again, good tissue to get helping the part that's a bad tissue or the part needs healing. So the body does it naturally, and this is a great way that it enhances that ability to get to the root cause, as you mentioned, and get the person to stabilize for the longer term. We really want the person to improve much more than just a couple of weeks.
Yeah, and then finally, our Serapin-based injection. So Serapin is a natural product. It's actually plant-based. It's an extract from the pitcher plant, and we use these Serapin injections for patients that have chronic muscle tension. We call that a trigger point injection. And then sometimes too, the big joint in your pelvis, the sacroiliac joint, can get restricted or locked up. A lot of scar tissue builds up. These Serapin injections help to not only relax the muscles, but also break up that scar tissue. And best part, because it is plant-based, it's a great alternative when you're considering maybe a cortisone injection, which damages the tissue.
Well, I think the key there is that we can utilize it to our discretion. We don't have a limit. Cortisone potentially causes some harm, but you only can do it so many times. So Serapin as a natural product, aspects again, natural anti-inflammatory properties, it really can be used every week for a short while. You can use it again monthly. We have the ability to use it to the person's need, not to say, well, sorry, you can't get it now because you already had one last week. This will help our treatment plan for all the services by getting in there and knocking down some of that discomfort in the tissues.
Right. And those are the 7 steps. If you're suffering with joint pain, you're definitely going to want to give us a call. We also offer a whole food-based medical weight loss program. So folks, we've been bombarded by commercials about all of these injectables for weight loss. Let's stop the madness. If you don't learn what proper nutrition is, you don't want to rely on an injection that is, number 1, really expensive. Number 2, you have to take for the rest of your life. And number 3, just look at the side effects of these injections. This is going to be a passing fad. You definitely want to make sure that you're learning proper nutrition. For more information about our clinic, you can always check us out on our website at maragalmedical.com. We also have a wealth of information on our YouTube channel. Please consider subscribing. And best yet, folks, we take most insurances. So that's it for today. I hope you learned something, and please pass this information along. We really want to help as many patients as possible. Have a great day, everyone.